This podcast episode is sponsored by Microbalance Health Products. For over 20 years, Microbalance has been formulating and offering non-toxic and environmental cleaning products, homeopathic formulas, and professional-grade supplements to help people recover their homes and their health from mold toxicity. Visit microbalancehealthproducts.com to learn more and shop.
Welcome to the Modern Day Naturopath Podcast with Dr. Sue. Real talk for those craving deep healing whilst living in a modern-day society. You'll be equipped with knowledge to make profound mind-body shifts that utilize ancient wisdom and will facilitate your healing once and for all. Inspired by Dr. Sue's chronic illness journey and all the real and raw pearls she has learned along the way. Come as you are. It's never too late to start.
Welcome back to the Modern Day Naturopath Podcast. This is Dr. Sue. Today we're going to finish our conversation on mold. We've had a foundational mold podcast that I'd love you guys to go back to. We have had at least 4 other mold podcasts talking about treatment options, detox, when the right time to do a binder is. So I want to welcome back Dr. Sparks, expert in mold illness, as well as naturopathic doctor at Naturally Sue Wellness. Welcome, Dr. Sparks.
Thank you for having me. I'm happy to be here.
I know we've been chatting so much about mold, but each time we do so, we find even more that we can share with people. So this topic is so big and it is so many intricacies, and it's really nice to be able to have us, because we speak to patients every day and you are an expert, actually have a conversation about this topic together so people can hear from a naturopathic standpoint how we actually think about a patient's case, how we address a patient's case. So I would love you guys to go back to those podcasts, watch. We have a ton on detox and making sure that you're actually not going to make yourself sicker, and then listening to this one after, because this one is going to be about the final stages of mold treatment, which involves that antimicrobial portion of the treatment. So a lot of times we'll see patients going right for the antimicrobial portion, and that's when they don't feel well. They're obviously feeling sick. So we want to talk about why it's appropriate to do this now after you've done all the foundations we've spoke about in our earlier podcast. And then we also want to talk about reactions that people have from mold. So what does an actual detox reaction look like? What does a Herx reaction look like? What is a healing crisis? You might have heard these terms before. And so Dr. Sparks is going to explain more of that. Before we go into the reactions, I want to just share a little bit more specifically about Dr. Sparks. Dr. Sparks is a naturopathic physician. She's also a licensed acupuncturist. She has a master's in Chinese medicine. She joined my practice now at least 5 years ago, helping tons of patients in my practice with all sorts of different issues. And more recently, we've added a bit more mold patients, because the more that we're learning about this, I even feel like attracting those patients in, just like I talked to Dr. Joe Christ about the other day, right? Do you feel that? Like the more you learn about it, all of a sudden now you're either picking it up or you're getting patients like this?
Well, and you're just seeing it everywhere. You know what I mean? So I have to be careful not to see it in places that it doesn't exist.
Right. And that's why I say to everyone, listen, I don't actually think everyone has Lyme. I just think a lot of people do that come to me, right? It's like
Right,
just the
yeah.
same thing with mold. It's like,
Yeah.
because you don't want to think that everyone, but it's so prevalent now. It's pretty hard to not have had that exposure and see these type of symptoms that we're seeing after that. But I wanted to ask you that because I noticed when I did more research or I've had an issue, I then started finding more of these patients, or they would just come into my DMs, or, I would find someone. I remember being at a what was it? What are those pressure chambers? Oh my God. Oh my God, hyperbaric.
Okay.
The hyperbaric
Sorry.
oxygen. I was doing hyperbaric oxygen. There was just a girl in the waiting room, and she just starts telling me about how she got so sick with mold and she might have been bit by ticks. And it's just like, how would I have just randomly came into like this office that I've never been to, and the girl just starts talking to me about her experience. So we are getting more of these patients, and because of that, we're learning a lot more just by their experiences. So I'd
Yeah.
like to talk a bit more, and I'd love for you to share. And also, before you guys forget, I'd love you to follow Dr. Sparks on Instagram. So you could press pause and then follow her. It's Dr. Sparks, DrSparks, and D on Instagram. She shares awesome things about mold. So tell us a little bit about this antimicrobial part of our treatment. And maybe for those who didn't hear the other podcasts, maybe just give them a little bit of an overview of, like, obviously the very basics. If you, of course, want to hear in depth about the foundations, go to those podcasts, but maybe just like basic foundations and then what kind of led us here.
Yeah, so, I'm glad that we're doing the series because, like you said, it's such a big topic and it's not a one-hit wonder, right? It's like, so what you were just saying, there are foundational things that we need to do. The big thing when it comes to any antimicrobial is to understand the difference between terrain theory, right, and germ theory. And, so in germ theory, which is kind of the prevalent theory in medicine today, is the germ infects you and you get sick. In terrain theory, it's basically saying, like, with genetics, environmental surroundings, and lifestyle, and mind-body, trauma, is your body a great home for those germs, and therefore are they able to proliferate, right? Is the immune system not effective at taking care of it like it's supposed to? Because you and I could be in a room with someone who has flu and one of us gets it and the other doesn't. It's the
Exactly.
terrain, right? So that's an important thing to understand, and that's why Dr. Sue and I talk about foundational stuff so much, because you need to work on the terrain, because I'm sure you've had it and I've had it, which is people who come to us being on years or months of treatments to just relapse because the terrain was never dealt with.
Exactly.
You know?
Absolutely.
So the things that we kind of discussed before were foundations, just, I actually just did a post on Instagram the other day about this, like, about biohacking and foundational stuff. I was like, if you're not, eating, sleeping, drinking enough water, moving, doing those foundational things, no amount of supplements or herbs is going to fix the problem for you. Like, it's just not. You got to fix the terrain. Then we were talking about, like, drainage pathways, opening those organs of elimination, because you and I have both seen also we have a lot of sensitive patients that they're not open as well, or they're just sensitive, and you try to kill something and now they're going to feel really, really bad, which we'll get to later. And then we have things like we were talking about with binding and supporting uh, the organ systems, like bioflavonoids, good oils, things like that. And then after you kind of get in, then biofilm breaking,
Yep.
because
Yep.
I can give you a bunch of antimicrobials, but if they're hanging behind some jello-like biofilm, good luck trying to get that to actually work. Now you're just spending money, getting nothing done. So breaking up biofilms and then eventually getting to where we are now with the antimicrobials.
Yeah, that's such a good summary. So those things set the stage, right, for your body to be able to do this even part of the treatment. So now let's just say your patient is up to the part where they did all the foundations and now you're like, okay, I want to do some antimicrobials. I do want to ask you, has there been patients who you feel like you've done the foundations and they feel so much better that you didn't need to get to an antimicrobial point? Because I've personally seen that, but I don't know if it's negligent to then not do that at some point, because if the person's feeling like 100% better, it's like, oh, do I really go in there with an antimicrobial now, right? Like they actually feel better. So I wanted to ask you, like, if a person has done all these foundations and they're like, I'm like a new person, do you even need to get to this stage where you kill stuff? Okay, good. I'm happy you agree with that.
Yeah. I mean, Dr. Krista talks about the peeling the orange, and she calls the foundational stuff the peel itself. And the number one thing in that peeling is getting away from the mold. And I'll tell you, a lot of people, like, we have that family that moved, and, with the foundational support that we gave them, once they moved, healed,
Yeah.
So, some people might need more detox. Like, I think getting away from the mold, you're going to get a huge component of people that are just going to get better. But then after that, you might need to help people with drainage detox more. You might, I would say, in a small percentage of people who get away from the mold, would you actually even need to use the antimicrobials? It's the
Okay,
people
that's
who
what I want.
don't get away from the mold that we have the issue with.
I see. Okay. So now where would you feel like, okay, like maybe give an example of now you're seeing a patient, you did the foundations, maybe they're like 50% better, 60% better. Um, what would you kind of see in them that would, or where would you be in the process that you'd be like, okay, I'm going to get to this antimicrobial, antifungal, and then what would you do then?
You mean antifungal wise?
Yeah, like, what would you get? So, for example, you have this patient and you did these foundations, and now you're like, I actually think, like, what about the case would tell you, I'm gonna do the antimicrobials now, these antifungals, and then what would you maybe give them, for example?
Ah, okay, yeah. Well, and one thing that I kind of skipped over is the one place where I do use antifungals kind of from the beginning is sinus spray.
Oh, yeah.
Because the spores can go in there, colonize. And if you're colonized, like we spoke in that other podcast more in depth. Oh, yeah, perfect. I think that one has the xylitol, right?
Yeah, and for those listening and not watching the YouTube, I was just showing they have the Microbalance Citri Drops nasal spray, so I was just showing it on screen just because this is a really good nasal spray
Homeopathic.
that does have microbials, but it's not like a systemic killing agent that you would give in like more of the, few months after you started process.
Yeah, it's a homeopathic, I believe, with xylitol, so it breaks up biofilms. And then the other thing too is, yeah, we don't want to have the colonization because then you're kind of reinfecting yourself, even if you get away from the mold. So, but when it comes to treatment, I think it, it depends, so what happens, I feel like it's like kind of like a stepwise process, like we're working on stuff, people will get better, they plateau, they get better, they plateau, they get better, they plateau. Um, and at some point, you're kind of like, we're doing everything and you've plateaued. Okay, it's time to go to the antimicrobials. And typically, I'm sure other people feel this way, but I really like to do kind of antimicrobials that have multiple different antimicrobials in one, because the mechanisms of action in different herbs are, work together synergistically. I actually, back in naturopathic medical school, I was a research assistant, and we did research that actually I think I'm published in. It's on
Wow.
PubMed, about the antibacterial resistance to of different bacteria to different herbs versus drugs. And I had a harder time creating resistance to herbs than drugs because with herbs, there's multiple mechanisms of action, not just the one, right?
Oh, I love that. I remember this now. I think you and a couple weren't isn't Vanessa too, one of our
Yeah,
other friends,
yeah,
naturopath. I remember she was in a she was telling me about it. I didn't remember that you were
yeah.
also
Well,
doing.
I actually gave a presentation at the AMP about it back in the day.
No way.
Yeah. So
Oh, we should
that's
try to
our
find that link
national,
to that study.
yeah. So that's our national conference as naturopaths. And I just said AMP like people knew what that was.
Yeah.
Yeah, the AMP.
Yeah,
Um,
yeah.
the research. Yeah, so that was, we had multiple theories, but, and then also herbs work synergistically, right? There was also another doctor there talking about how microbes in the soil actually might also, like good flora in the soil might then be on herbs that are tinctured, and, their mechanisms might also be part of what's helping people. So I thought that was interesting too. And another reason to take from Mother Earth, instead of chemicals.
Yeah, see, nature heals,
Yeah.
right?
So
I love
so yeah,
that.
did you want to talk about a few of these that we like,
Yeah,
that we
I
use?
I would love to. Yeah, so first are those you wanna show the Citri drops from Microbalance? Yeah, so those see those little right there, okay. So for any of you listening, you can also look on YouTube so you could see some of these images, but we'll also put information on the caption that you can find all of these because we have a unique landing page that will be all of the products we talked about on the podcast, and you can use MDN for a discount on all of these. But the Citri drops, basically broad spectrum antifungal, which is exactly what Dr. Sparks was talking about, because the broad spectrum, like you said, there's multiple different herbs that have different mechanisms. So yeah, do you want to talk a little bit more about what's in this one and more about when you would use this?
Yeah, I would say a lot of people have heard about grapefruit seed extract. So it has that, but it also has lemon seed extract, lime seed extract, and tangerine seed extract. So, you're using, again, synergistically the different fruits coming together to work and help heal the body. It's kind of just what we're made for, and it's all natural. So it's things that that you and I would use and do use. Oh, the other thing that I was with dosing is sometimes, you can use Citri drops like we were talking before in a different podcast about using them like in a neti pot. That would be like maybe 1 drop. But then if you were going to use it internally, you would do maybe like, well, if you're sensitive, you're going to probably do 1 drop, right? But if you're not sensitive, maybe closer to 5 to 8 drops like in a glass of water. So that's,
Okay, so they would just take that once per day ish, and
yeah,
then if they are sensitive too, they can maybe just like sip a little bit of
see how
that
they do.
throughout the day and
Yeah.
see, and then maybe go up in
Well, because
dosage as they feel.
you know how you dose the knotweed with Lyme patients, like in a
Yes.
bottle, and you're sipping it over a week? I had someone doing that, and they still were having a reaction because it was like a lot for them. So I was like, okay, then you need to like dilute that bottle. I mean, sensitive people just, yeah, you gotta really do diluted stuff. So start
Really
slow,
do.
you know?
Start slow, and I wanted to mention about that so I gave a patient, so one of the herbs we use for Lyme is Japanese knotweed, and so what Dr. Sparks is talking about is a lot of patients, when they're at the proper place in their treatment plan, we will tell them, okay, takes this amount of drops and increase, each week in a water bottle. So, and then they sip on it throughout the day. But she was saying even just diluting, even just 1 dropper full in a bottle of water, even if you sip it throughout the day and it's diluted, is too much for people. And then people will say, yeah, but I just had this conversation with someone the other day. Yeah, but I want to get it over with. And I said, yeah, but you're telling me you're severely ill. You want to get it over with. So then we're exceeding your pathway's ability to get stuff out. And then we're going to actually cause more issues with just the recovery part. You're going to be so exhausted and from flared for so long, it's actually going to be longer if if I'm pushing you. Like I had this woman say, yeah, like I just need to get it done. Meanwhile, she had just taken an oregano and it like put her into a flare and she wanted to now take more. And I said, but you were so unwell, from this amount, we don't want to do more. So I'm bringing that up because people always think like in order to get somewhere, you have to do a lot. But I'm sharing this story because I had a patient who did 1 drop of Japanese knotweed, 1 drop. That is it. And she said her foot pain that I believe has been related to Bartonella for probably ever. She had Lyme disease, but she's again the most sensitive patient. She said her foot pain, that like tendon, I think it's like you get this like I think it's more by like the Achilles tendon. It's usually like, or it could be anywhere in your foot. I've seen that a lot with Bartonella. She said it was gone with 1 drop. So I really, that was a lot of learning for me in that moment because I felt like even though I kind of knew that little can go a long way, her body, that's all it needed.
Well, and
It's like we didn't need.
the eclectic herbalists of yore, right, in the 1800s, early 1900s, they did drop dosing, a lot of them, right?
See?
So, as Americans, we're like, more is better. Give me the bigger cart at Walmart. No, you don't. There's also like an energetic response. Our bodies
Yeah.
are aligned with herbal remedies. Like we're meant to use them. Where, I mean, Native Americans could sit with a plant and learn the properties of the plant through meditation. You know what I mean? So there's a lot more than we are understanding as people who are kind of inundated in a Western society.
Yeah, thank you for bringing up the energetic part of it, because just like you said, it's like her body was just one with that pl it's like her body wanted that plant, and she did
100%.
a drop, and she's like, her foot pain, and I ask her every time, and I'm like, "Is your foot?" She's like, "Yeah, it's, like, mostly better." Like, it's al almost, like, 100% better. It's like, wow. It's like, and then when she's flaring or the weather, sometimes like that, then that will affect her, of course. But yeah, I wanted to bring that up because essential oils that which are in here can be really potent for some people, especially if if they do have a high fungal load. So just the point is just don't push your body and go slow. And even if you have to, I remember our mentor used to say, like, if you have to take, like, he used to put, like, one of those the Unda numbers, which are those biotherapeutic drainage. He used to put a drop in a bathtub and make people lay, like, in the bathtub. Like, that's how sensitive some people were. So, just do whatever your body can handle, and don't, if you're listening to this and you wanna, DIY it, don't just pound a ton of citri
Right.
drops,
Yeah.
please,
And then
because I
be
guarantee we'll
DMing
get a
us.
message,
Yeah.
and then we'll get a message. So, yeah, please don't do that.
If you're dealing with mold exposure or fungal overgrowth, you know how tough it can be to find the right support. That's why we love Citri Drops dietary supplement from Microbalance Labs. It's a powerful, natural antifungal that actually works. Citri Drops is a broad spectrum antifungal that helps lower candida levels in the blood, supporting your body's natural detox pathways. Unlike single compound antifungals, which can lead to fungal resistance, Citridrops uses a blend of multiple citrus seed extracts, making resistance virtually impossible. And because it's all natural and non toxic, you can feel good about using it as part of your mold detox protocol, whether you're fighting candida, mold related illness, or just looking for extra immune support. This formula is a game changer. Check out Citridrop's dietary supplement at microbalancehealthproducts.com. And don't forget to use our exclusive code MDN for a special discount.
So we have Citri drops that you could take internally, the dietary supplement. Then we have the Citri drops that we've shared before, the nasal spray,
Homeopathic, yeah.
homeopathic. And then one of the women from the company actually shared a link with me to a really small baby cute, like, diffuser that you can travel with. And she told me to bring the Citri drops, the dietary supplement, and just put the drops into this little diffuser. And so literally when I got to New York last time, I literally was the first thing I took out of my suitcase, and I put it on, and it will start, I think it just, I don't remember, but it will, like, start diffusing like every X amount of minutes. And it just did that for the few days that I was there. It just felt better knowing I was doing something, because you travel and there's probably, especially in New York, there's water damage in hotels, there's water damage. And what are you going to do? It's like you don't want to not travel, but it's like, what can I do to support myself as best as possible? So feel free to also use those drops. Besides, like Dr. Sparks said, in the neti pot, you can do the nasal rinse, but also in this diffuser that you can even travel with, or your home diffuser.
Yeah. And it also helps with bacteria, right? And viruses. Like it's immune support as well. So anything that you would use grapeseed extract for, you can use this for because it has that plus more.
That's very true. So if especially you're, around people in a house that, might be sick, that's also nice to put throughout the home. So that's something you guys can do to protect yourself when traveling. And then do you want to talk about some other antimicrobials that we like, either single herbs or even other blends? Are there ones that you've used the most because you've seen them effective, or ones that you just like out of our list?
I would say probably one of my favorites is biocidin. And I like the liposomal formula because you can even use it in young people because it tastes good. Because that's a big obstacle for people is taste, especially in this country, right? So it's kind of sweet, the liposomal formula. But again, it's gonna have, I think it has like 8 to 10 different herbs in it, things like garlic, black walnut, I believe, things that we like individually, just compounded and either in a drop or that one's a pump, the liposomal. But that's probably
Just
one of
make
my
sure,
favorite.
is that the LSF, or is that is that, because there's a biocide in LSF that I think is a bit more potent, and I've always personally with my patients don't do the, like, I start with a regular blend first because I'm afraid that that one's gonna be too potent,
Okay.
but that one everyone uses, that liposomal one you're talking about. It's just my population of people, I would do the regular one for them first. If they could tolerate that, go to the liposomal, because I think it just goes even more intracellularly and it just dumps out a bunch of stuff, but it's really effective. Like, if you're a person who deals with detox well and you've not had any symptoms, then that's a great, really effective one that's a lot of naturopaths use, especially for Lyme disease and gut infections too.
Yeah. Yeah, I use the drops with people who are super sensitive. Uh,
Yeah,
and
because then
then
you can titrate.
yeah. The the other one from that company that I really like is Oliver Rex. That one's geared a little bit more towards fungal pathogens, so that's another good one.
I love that one, even for Epstein-Barr and, like, viral
Right.
reactivation. It has, olive leaf in that. I love that one. I usually give that to people, like, when they have, like, a lot of, like, Epstein-Barr which most of the Lyme patients, there's always, like, some type of viral reactivation or there's some type of other thing. That's one of my favorite products by them.
Yeah. What else do you like?
Well, I'm just looking at our list here because there's so many. I use Oliverax. I like Mega Myco, I actually like.
Oh, right. And
That's, I always say it wrong. I think it's undesolenic acid, which is this fatty acid derived from castor bean oil, supports healthy balance of yeast in the gut because it has also propolis, which is that plant resin. I love putting propolis on my smoothies, the
oh,
organic cafe. So when I went to Erewhon the other day, I bought it, and I put, like, 4 pounds on my smoothie today, but, yeah, it has propolis also in it, and that is also good for the immune system, so make a myco. But again, I like the more broad spectrums. What else do I like?
well, but I mean,
Ber
what?
Yeah.
What were you
I
gonna
was
say?
gonna say berberine I like for people who, let's say they have, like, metabolic stuff going on, maybe some gut stuff, because berberine can help with cholesterol, blood sugar, and it's an antimicrobial, so that's a good one too, I like.
Yeah, see, then that's like the opposite. You have one product that does a lot of different things, you know,
Exactly.
instead of a lot of products that do one thing, or do, things together. But,
Yeah.
but then like you were saying, yeah, we love the combination products, but sometimes, especially with sensitive people, it's good to do a single product because then
Yes.
this thing is like hurting or not hurting, is good, not good, because sometimes if you're doing a multiple, a blend, then okay, well, what thing in there was the thing that they're reacting to? You don't know.
You don't know, that's, like, so confusing, like, about with the protein powders. The protein powder will have, like, 42 vegetables, and it's, like, green pepper, but, tomato, and I'm like, "Well, maybe it's a nightshade, or maybe it's this, or maybe," that's why I'm like, they want a protein powder, I'm like, "It has stuff like 3 ingredients or something," because I just don't know what you're gonna react to, so I'm so happy you just said that, like, if you are sensitive, just maybe 1 dose served, and you're like, "Oh, this is making me not feel good. I know it's this," opposed to it's the one ingredient in biocidin, and we would never know.
Yeah, and then I mean, for example, like you talking about the knotweed and how potent that one thing was for someone, or I've had someone who, we've tried lots of different things, and they're like, you know what, I do really well on cat's claw. It's like, oh, okay, then just do that. Like, that's the other thing is like if you're doing one thing, then you know how you interact with that, and it's safe for you.
Yeah, and how many patients have you had that you'll give them Teasel for, let's just say, Lyme, and they're, like, feeling like they're gonna die, and then you give them cat's claw and they feel amazing, and so you're like,
Yeah,
"Okay, well, probably not gonna use Teasel anymore for you," you
yeah,
know?
or the
And I'm fine
opposite.
with it.
Yeah,
Yeah, or the opposite. Yeah, sometimes you just don't know, and also, what about, like, a indirect way, like with, for example, Microbalance has that IgG gut protect. So they call it's a basically a bacterial binder, mucosal protector. So that could be an indirect way right? As you're killing off some of these things, also as a binder, and then to support the immune system in the gut, which can help with overall healing. So, yeah, I don't know if you have anything to add about immunoglobulins and how you feel about those.
Well, I think that harkens back to what we were saying at the very beginning about the terrain, which is, we can try and kill as much as possible, but even the best antibacterial or antibiotic in the world they give you intravenously, in the hospital is there to kill enough bacteria or hurt enough bacteria so that your immune system can take over. If the immune system doesn't have the ability to take over, you do not win the battle, no matter how much they inject into you. So same with us. So that's why we're always working at immune regulation. So that's a really important thing to talk about. Yeah, that's good.
Yeah, right. Just like, again, going back to those foundations. And then I personally never used yet the Sinus Defense 2.0.
Oh,
Have
I love
you?
it. I love it.
Oh, you
Oh,
do?
yeah.
Can you
Okay.
share more about it?
So, this is also a homeopathic, but it's for under the tongue. I'm a baby, so I can only do sinus sprays once per day, and I usually do it in the morning. But then at night, especially in the winter, it's really dry, and then my sinuses get all clogged, and I have a hard time breathing when I'm sleeping through my nose, unless I use this. I mean, literally one spray, and I can like breathe again.
Really?
I
Do you
think.
think I should use this for I just had a patient who had Marcons come up. I could just
Oh,
do that, right? Because it's just gonna, so it says here in, a way to desensitize the body to fungal pathogens. That's what this product does, Sinus Defense 2.0. The transfer factor in the sinus defense helps the body identify and tag fungal pathogens to decrease reactivity and helps lots of sensitive people who can't start with antifungals yet. That's super interesting. Do you think that well, I guess when I was asking about Marcons is a bacteria, but most people who have Marcons get it because of mycotoxin illness. That's the
yeah.
reason that
And
most
it's
people have
probably
it.
hanging out in
So
the biofilm with it,
yeah, right? I can't see how this would hurt. Oh, that's awesome. So I'm so happy you use that. I haven't used that yet because they're always like, wanting to stick stuff up their nose to feel like it's getting up there, but you could spray this in your mouth and it's still because it's homeopathic. It's doing the thing for the sinuses.
Yeah, within a few breaths. So I was like, "Oh my gosh." And
Wow.
oh gosh, what I was just gonna say. Oh, you remember in med school when we're learning all our physical exams, we're supposed to like stick the light up
Yeah.
and look in the nose, and then we're like, the turbinates are boggy. All right. So it's like these whirly things inside your nose that kind of push air through it to get rid of, like, to trap toxins, right? But then also to moisturize the air, blah blah blah. But if they're inflamed, they get kind of boggy. So I imagine that as kind of like if you had a sponge, that's like the difference between a dry sponge and a wet sponge. But that's like inflammation. That also kind of happens, I think, in the lining of your sinuses and then in the lining of your nasal passages. It gets boggy, it makes it hard to breathe. But I feel like when I take the sinus defense, the bogginess I feel like decreases and I can breathe better.
Wow, so it's almost like you just feel like kinda like a
More
almost
open.
instant deep out or like the
Yes.
inflammation internally kinda goes down, so you just feel like you could breathe, but it was probably, like you said, it's like kinda like astringed those boggy tissue, like, kinda like wrung it out, like
It's kind
the
of
bog.
like what they wanna do with, is it Afrin? One of those, Flonase? One of those where they're
Yeah.
trying to restrict the blood vessels to, it's the same thing. But they're doing it chemically. This is naturally. So this homeopathics is having your body do it for you. You're not forcing your body to do anything it doesn't wanna do.
Oh, I love this. Thank you for sharing because I haven't used this on a patient yet, so I'm happy you did it with yourself, and we're guinea pigs, that's why we have, like, I wanna see who has more stuff in their house with products and
Oh my gosh.
supplements. It's actually kinda crazy. If you add up, oh my goodness. I always say to people, they're like, come in my house, they're like, "Whose are those?" I'm like, they're like, "Oh, you have a store?" I'm like, "No, they're actually
Never mind.
they're mine. No one gets them but me." Do you ever need to actually give antifungal, like, have you ever seen a patient that you've said, Wow, nothing that we've done so far antimicrobially or the foundations moved the needle, and I need to do an antimicrobial from an RX standpoint, like an actual pharmaceutical. Have you ever seen it? I personally haven't seen that, but have you?
So I'm not in a state where I can RX, but I have seen one person that did, and so I sent her to her MD for it,
Mhm.
and it did help her. Um, but yeah, no, I typically just use herbals, but they're available for the people who need them. You know,
Yeah. Yeah, I was just curious if it's common. I don't see it as common. I've had patients who've said they've taken them before from their medical doctor, like, we can't prescribe them, but we'll always tell them, "Hey, if we really feel like something's out of control, we'll say, 'Hey, go to your medical doctor. Maybe you need to integrate this pharmaceutical,'" you know, and this doesn't just have to do with mold. This could be anything, right? This is
right?
where crisis care comes in, or we're like, "Hey, I think you may need this pharmaceutical while we're working on this temporarily. Talk to your doctor about that." But there are antifungal medications out there. So just wanted to share that with you guys. If some people who, have been in a really, really toxic mold situation and maybe they need to do that, that is available. But of course, talk to a medical doctor who has mycotoxin illness experience. And then, is there anything else you want to share about the antimicrobials before we get to the Herx detox and healing crisis part of this?
Well, just to kind of add to what you just said,
Yeah.
is you were saying, like, an MD who has mycotoxin illness. A lot of MDs are gonna poo-poo mycotoxin illness talk, just so you know. Um, and a lot of naysayers will say things like, "Oh, so people are just having mycotoxin illness now." You know what I mean? "Oh, it's become a thing. Is it because of Instagram?" Or whatever. There's all the negative things that people will say, especially to a sufferer, God forbid, and tell them that it's in their head or whatever. But what I wanted to say about that is that, no, these things have been around for millennia, right? Because fungus has. It's been decomposing bodies for ever since there's been bodies. But
Yeah.
back in the day, we were giving it different names. So what we're talking about with mycotoxin illness is root cause medicine, right? Whereas back then, it was probably called chronic fatigue or fibromyalgia or the vapors or whatever, you know what I mean? So, yeah, no, these things have been around and people have been feeling horrible for lifetimes, but we're just learning more now, right? So I just wanted to say that. And so if you have a doctor who doesn't understand it or is a naysayer or whatever, it's why you have us, right? Like, so then we can help you with the terrain and all the other stuff. And then if you needed to go to the doctor, you have the combination of the two people together.
Exactly. I'm so happy you said that because with first what you said about conventional doctors may not even know a ton about that, but let's just say it was a conventional medical doctor and they were willing to give you a pharmaceutical, like you said, then we would add some stuff to it and make sure we're doing all the naturopathic stuff. But then there are some like functional medicine doctors who at least won't poo-poo you and be like, oh yeah, this actually is a thing. But you're right when you say it's been there this entire time. And we're just like, now it's kind of like how everyone now is like, if you notice on your Instagram, everyone's talking about perimenopause and the horrible symptoms that you can have as a woman that you didn't really there. Everyone's talking about it more because now there's more research debunking some of those studies about bioidentical hormones, how they pegged it as this cancer therapy, but it's really not. So now people are actually learning more and they're like, oh wow, I didn't have to suffer 20 years ago like I did, like these women who are in their 60s, 70s now, and they were suffering because we're learning more, just like mycotoxin illness. The more you learn about something, so it's not a reason for them to say, oh, well, now we're just bringing this up because it's on Instagram. We're bringing it up because people are sick and they're talking about it and we're learning more, right? So, yeah, thank you for bringing that up.
Yeah, and I think the information age has really changed a lot of that. The other thing on the flip side of that to be careful about is, even our podcast is don't go around self-diagnosing yourself and your family and your friends because it's very intricate. I mean, mold can look like a lot of other things, right? You can have, that's why sometimes we don't find mold in someone until a couple sessions in, because we're like, oh, they're just having SIBO, or maybe they have EBV, or maybe it's mold. You know what I mean? So, there are fads on Instagram and all the other, platforms. One month everybody has parasites, next month everybody has yeast, blah, blah, blah. But so just be careful. The best thing is to find yourself a practitioner that you trust.
Absolutely. And you're right about the parasite thing. Do you know how many patients come in and tell me they have parasites and candida and they actually don't? And they actually have no bacteria in their gut and they're pounding. Like I have one patient like pounding parasitic like herbs and oregano oil and all of these things and pau d'arco and all this stuff. And they actually don't have it, further depleting their gut. So while we love you to use your intuition and we love you to learn, if you are suffering, it's actually less expensive to just hire someone like a naturopathic doctor to say, this is the actual thing you have. So then we'll treat that, or, we're going to help you with that and you're going to get better, opposed to I'm, treating all of these random things. And like, I love their intuition, but a lot of times they have symptoms that are looking like candida, but it's actually not. And then you're like, wow, the treatment that they would do on themselves as a DIY is actually making them worse. So I'm happy you brought that up about the parasite and candida thing, because if I had a dime for every person who told me they had a parasite and candida, I don't even treat those things right away anyway. Like I just fix, like let's just say they don't have money to do a stool test. I'm just like doing naturopathic medicine, and then they're feeling better. They don't even need to do any of that stuff that they thought that they did.
Yeah, I mean, I've actually had the meet and greet 10-minute free consults with people that they say 100% they believe they have a parasite. And I'll say, like, okay, we can test to see if you have it. The stool tests that we do are really, really accurate, blah, blah, blah. But if I don't in that call 100% agree with them that they have a parasite, like, they won't come see us. It's like they're convinced, without any testing. And I'm like,
Yeah.
so a
I know,
lot of
but what
those
if it
symptoms cross over to other symptoms, to
right.
other things.
Right, or what if you believe them? Like, I like this one girl's like, "I definitely have parasites, I see them in my stool." But I'm like, "But are you at the point where you're this depleted to kill them?" So, like, just by doing the basics and the stuff that we needed for her for 4 or 5 months, she was, like, 80% better, and then she did a parasite cleanse, and she felt even better after that, but that was the right time. So it's not that we don't believe you if you feel like there might be something and you're seeing something in your stool, it just also may not be the right time for you to do it.
And I can't just
So we
say,
wanna
without knowing you or doing an intake, that 100% I believe that that's what it is, you know?
agree, agree, absolutely. And can you tell me a little bit more when you are, let's just say, killing off parasites, killing off mold, killing off Lyme, you will often hear words like, "I think I'm flaring, I think I'm having a" "is this a detox reaction? Is this a Herx reaction?" I read online that there's such a thing as a Herx, like, "Is this a Herx?" I read this thing online, or I heard from this other naturopath, they might be having a healing crisis. So these can be really confusing, even to some naturopaths, to try to figure out what it is. But can you share when patients would, like, what symptoms they would have, or what would tell you that they're either having one of those things, and how you look at it as a naturopath from your lens?
Yeah, so, I always got to harken back to our elders and our mentors. And I even like to plug the Naturopathic Medicine Institute, because that's where our vitalistic mentors are currently teaching. And I think they have stuff for the public as well. So you go to Naturopathic Medicine Institute, I think it's .org. I'm not sure, maybe .com. And so they trained us in the ways of the old guys, from the 1800s, early 1900s. And but I don't think anybody really used detox reaction back then. So I kind of compiled it into 3 distinct things. One being a Herx or a Herxheimer reaction, another being a detox reaction, another being a healing crisis. So the Herxheimer reaction was, I believe, was a Dr. Herxheimer who realized that people would get worse initially when they got treatment for syphilis. So they would be killing them too fast. We call it sensitivity. And so basically, it's kind of like this battle between whatever the agent is, the antimicrobial, your immune system's helping, and then whatever the germ is, right? So it's basically you're having this battle, you're killing germs, and then when that happens, you have dead immune cells, you have metabolites, you have dead bugs, all of that's kind of going into the lymphatic space, maybe not getting out through the liver, through the kidneys, through the intestines as fast as it needs to, and then you feel worse, right? And so that's basically referring to killing bugs too fast, right? And then feeling horrible about it. We can talk about symptoms in a second. And then a detox reaction to me is basically the same thing feeling wise. And you've got a lot of sludge that's not getting out fast enough, but it's not necessarily killing bugs, right? It's just whatever. It might be an environmental toxin. It might be a mold. It might be glyphosate. I mean, it could be anything. It could be heavy metals. And so again, we're trying to get it out faster than the organs of elimination or emunctories will allow. So again, you're going to feel bad. The healing crisis is, in my opinion, a lot different. And this is what comes from our mentors. A healing crisis, so in acute illness, is something that's kind of up to 6 weeks, a cold, a flu, a COVID, whatever, where your body mounts a response and you heal from it, you don't heal from it and you pass away, or you might use a therapeutic that's not very helpful and you end up with then a chronic condition, or you do something kind of wrong and end up with a chronic condition from it. Or, there's also just chronic conditions. So chronic illnesses, autoimmune illnesses, chronic Lyme, long COVID, like all those things are usually over 6 weeks. And your body can't just mount a response and heal it. And so it needs an outside intervention, like we were talking about with the terrain, working on the terrain and doing everything that we do, right? So that's important. But what happens with a healing crisis, and the reason I love it is because it happened to me. So I had mold illness. Well, back then I didn't know I had mold illness. I had hives all over my body with swelling. I mean, the histamine, it felt like my skin had a million bug bites and a sunburn all at the same time for 2 years. Now, it would get better a little bit when I would use antihistamines or like dehist, things like that, trying to control histamine to do the things that we do to kind of control symptoms. But as we both know, that's not healing. That's what we call granulopathy, or managing symptoms, right? But at the same time, I finally got to a place after exhausting so many different things where I realized like, oh no, I need to work on root cause. So I had done everything under the sun, but then finally I decided on doing 3 things. One was taking Chinese herbal formula. Another was taking humic minerals. I was doing the ion gut formula. And then the other thing was meditating every night. Actually, I was holding a selenite wand while meditating and just trying to ground and breathe and relax and get my nervous system regulating, because I feel like my nervous system was part of, because I was so traumatized by having the hives, right? And didn't know where they had come from at that point. So then one day I just got a fever of 102, and my hives, even though I had had it kind of suppressed from the Zyrtec or whatever I was taking, I don't remember, antihistamine. So I had 102 temperature and then full body hives again after kind of keeping them suppressed. Couldn't keep it suppressed, and fatigue. Those were the 3 symptoms I had. I had no upper respiratory issues. I had like no flu symptoms other than that. And I said, this might be a healing crisis. So a healing crisis is going from a chronic state to where the body turns it into an acute state, and then the body heals it, right? And that's what the naturopathic doctors of yore have taught us. And so I said, oh, maybe that's what it is. So I just stayed in my bed and drank water for 2 days. And I was miserable. And then all of a sudden I was fine. And then, of course, was it Herring's law of cure happened? I mean, I could hear Dr. Sunsenig, our mentor, like in my head. My hives started disappearing from the top down. And the last place I had them was on my legs. And then they went away and never came back.
Oh my God. Because Dr. Sensitive would always say, and I wrote a post, healing happens from the head down, inside out, in reverse order. And if you start seeing the symptoms that were ones on the head coming down to the body, or symptoms that were right, they'll just start as they'll go down the body.
Yeah.
And until they make their way out.
Yeah.
Oh, so
So
amazing.
I had a healing crisis and I healed, and Herring's law of cure obviously healed them from the inside out and from the top down and from the most important to the least important, blah, blah, blah. So that's what a healing crisis is. It's bringing the body from this chronic, I can't mount the response I need to mount to get rid of this thing, into the acute, I do have the oomph, I do have the terrain to get rid of this thing. And then it's usually pretty intense, maybe not as intense as the first time. So I had bad hives, but not as bad as they were when I first caught them. And so it'll be intense, but not as intense. And it will be kind of long, maybe 2 to 3 days, but it's not going to be much longer than that to have a healing crisis. So those are some things to know. But
Yeah, how would you confusing between, like, even personally, because I'll be like, "Was this a detox or did I have a healing crisis?" And I always ask, like, "How many healing crises can I freaking have?" I think I've had, like, people will tell me, like, throughout my treatment of naturopaths, "Oh, it sounds like a healing crisis." I'm like, "How many can you have?" But, like, what would you say is, like, the what would you say is, like, the main for people who are like, "I didn't even know there was a thing called a healing crisis," and just to, like, make it super easy for people, like, how would someone really know, and maybe give an example with yours, that it was a healing crisis versus it was just a herx?
so So I will say this, many naturopaths who aren't trained by our mentors will use healing crisis when they mean Herx or detox reaction. So
Mm.
that's a good distinction to understand. So remember I told you the Herx is we're dealing with germs, and then it's like they're not coming out fast enough, and you feel usually kind of like achy, tired, headachy. Maybe you're having like GI symptoms. Maybe you're just having a little bit of exacerbation of your whatever your symptoms are. And that same thing will happen with a detox reaction, right? So the reason you know that it's one of those is because when you back off the therapeutic, you feel better, right?
Okay.
So you stopped the therapeutic, you're feeling better. Okay. Or you did another thing, which you and I love. We added castor oil packs, movement, water, lymph massage, whatever it is. Like we opened the organs of elimination and moved lymph, and now you're feeling better. So those two things, you're like, okay, that was either, it would be a detox reaction if it was environmental, and it'd be a Herx reaction if it was a bug, right?
Got it.
And then the other one is I have been chronically dealing with X, and now all of a sudden the symptoms when I first got like Lyme. Okay, when I first got Lyme, I had cyclical fevers, I had this, I had that, I had fatigue, and now I have all those symptoms again. I haven't had them in 20 years or 10 years or 5 years. And now I have them all again, but like not as bad as that first time, and only for like 2 days. And now I'm feeling so much better and I feel like myself again. Healing crisis.
Got it. So it's also like a return of old symptoms.
Yes, yes, more of a return of old symptoms instead of
I
that
haven't had
sludgy.
that thing. Got it. Like, I haven't had that thing since, or like, here's an example. Could you say, I haven't had eczema since let's just say, I'm giving an example, 7, and all of a sudden I have this eczema that I haven't had since I'm 7, and now it's coming up and I'm really exhausted, and that's more of like a healing crisis. And I remember Dr. Hazel would say, because she would talk about healing crisis all the time, that you have to really support someone in a healing crisis because it could get like dangerous for some people. Like, she would just say, like, for example, she would make sure they're getting obviously enough hydration, rest, and also protein, she would say, because she's like, we want to facilitate whatever is, even because in a healing crisis too, I'm sure there is a detox component of getting stuff out
Right.
of the body,
Yeah.
right? She's like, "We wanna make sure the liver." I always remember her saying that because I did her that was like at her house, one of her
Oh.
healing, and what was it called? She had like these, it was like these healing intensive things where we would like put mud all over our body, like all this crazy stuff. And they were jumping in this like from like hot to cold and sauna to this. And by the time I was done with that, because I didn't have Lyme, you could like have me on the floor with like my tongue stuck to the floor because I was like gonna die. And I remember getting a fever there. And she was like, "Sue, you gotta go home." I'm like, "No, I'm not going home," because I wanted to be there so bad, and I felt like, like the FOMO, the fear of missing out. So I was like, "Oh my God, I know I gotta be." She's like, "Okay." So she like put me in a room. She's like, "We just gotta lay here the whole day," because I had a fever. She's like, "I think you might be having a healing crisis." And I laid there and I just like kept the door open so I can hear all the stuff that she was teaching. But she would say, like, I remember she gave us an example of a patient of hers that she would, she was like, you have to make sure she was like giving him like turkey slices throughout like every few hours to just help his liver. She was like, listen, if you're going to be detoxing during a healing crisis, you want to make sure that there's enough protein that you can actually get these toxins out of the body. So she was like feeding him like matcha, water, rest, and like turkey slices. So she was just saying that you want to make sure you, and obviously it's not for everybody, but I'm saying you want to make sure that you're supporting your patient through it so that they can get to the other side, because it can feel a little scary for some people when they're going through that.
Oh, yeah. I mean, I thought, like, what the hell? I haven't had hives in, like, well, I can't say I haven't had a big flare of hives,
Like
for
that.
like
I
6
remember.
months, you know what I mean?
Yeah.
Like, and all of a sudden, here I am like this, and my sister was going off to Asia, and I was gonna be alone, and I was scared. And I had the education, and so I think that's important for us to talk about these things to educate people because, as you know, in our practice, a huge component of what we do is teaching people stuff, because they, healing naturally and actually trying to work for cure is a different process completely, you know.
Oh, yeah. Absolutely. And detective and
And I'm
putting the
thinking that
pieces
turkey
together.
slices might have been to increase protein to
Amino
make like immunoglobulins. I cannot speak on Fridays. And to help fight whatever was needing to be fought, you know?
Yeah, I think it was and then also she kept saying amino acids, but she was just saying something like, "We need to support his detox pathways, too." I remember
Yeah.
her saying that. She was just really giving him, like, turkey. I'll never forget that. You know when you just see like, you just hear a story, you'll just never forget it. Do you give people, like, for example, like that bioactive binder by Microbalance? Would somebody benefit from this when they are in a Herx or a detox reaction if they're not already constipated,
Yeah.
just to help them move through it?
Yeah. So that's where binders come in handy, especially. So that's the other thing. We don't even have to give you antimicrobial. We might be in the breaking up a biofilm phase, and those bugs get out and wreak havoc, and you need a binder then, or you could have a Herx reaction or detox reaction that way. So binders would be definitely great for that, and there's all different types. That's a great one. That was a little more potent, right? Because I believe there's charcoal in that. Um,
Yeah, there's activated charcoal, shilajit, fulvic acid, zeolite.
yeah. Oh, zeolite's great.
Yeah.
Yeah. So, and then, for someone who's not as sensitive or maybe is doing lower dosing, you know, things like fiber or ground seeds, things like that can be good binders that you can use all the time. These type of binders you want to use mainly when you're dealing with a Herx or a detox reaction.
Okay,
Which
got it. And it yeah.
I was gonna say that's another big thing, right? How many people have you had come, like, kind of to you to start, and they've been with another practitioner, naturopath, functional medicine, whoever, chiropractor, and then they're just kind of like on an antimicrobial and a binder for like months, and it's like, oh, you shouldn't be on that intense charcoal or clay binder for that long. It's just
I
it not
know.
great.
And also they're getting them on, like, Amazon, and a lot of them have heavy metals.
Oh,
So
right,
be
yes,
careful. I did ask, Microbalance because that's very important to me, and I asked them if they've done testing, and they said it's purified for any heavy metals. Like, it's different if there's, like, a little bit of, like, there's lead in our lead is a mineral, and it's in the soil, right? And even the lettuce has lead. There's a difference if there's, like, micro amounts of a mineral like that versus high doses. You're trying to detox and now you're just adding heavy metals back into the body. So don't just give random binders. If it's the appropriate time for you, this is a good one, the microbalance bioactive binder. You could definitely try that. But when you are in a healing crisis, lastly, like there's some things that you should just make sure you do, like the rest, hydration. Don't push the body more and keep taking more and more, right? Like,
Yeah, you can look up on my YouTube channel, which is Dr. Sparks ND as well. My video, Fever is Your Friend, because when you're dealing with a healing crisis, you'll oftentimes have a fever because you're finally able to mount that response, right? So there are things that you should and shouldn't do with a fever. And so, I won't waste all your time now talking about it, but watch that video so you know what to do when you have a fever.
Dr. Sparks has the best. They're called, like, what are they called? Doodly?
Yeah, Doodly.
What are they?
Yeah.
Doodly. I'll never forget that name either. Doodly. And
Yeah.
she does this little, like, doodle. Like, it's like doodle images.
Like drawings, like
drawing
whiteboard
it
kind of drawings. Yeah.
to explain a lot of naturopathic philosophy. Office manager Megan is obsessed with them. She's like, I think I probably would once a month have Megan say, Dr. Sparks needs to do this, doodly again, because she did one as Fever is Your Friend, which is amazing because people have a very convoluted perspective of what they need to do for fever because of conventional medicine that can actually be worse for you. So please watch this video. It's so good. We'll also put in a link for you. And you have another one called is it the Toxic Body Bucket or?
Oh, there's Detox in the Body Bucket, which isn't a doodly. I got to turn that into a doodly. Actually, I am turning that into a doodly. But Symptoms Are the Body Going Right is another one.
Oh.
And Why Do We Get Sick is another one.
Oh, yes, there's 3 of them.
No, there's another. I forgot I have, so now you've been diagnosed with mold. Now what? I forgot about that. I have a mold one.
You did that?
I did a mold one. Yeah.
When did you do that?
Like last year, I think.
Oh my God.
Yeah. So there's a mold one there too. We can link if you want.
I don't even know that. So I have no idea how I don't know that. So either you didn't tell me or I have no idea you did that one.
Yeah.
Okay. So now we're going to put all 4 of the doodlies to explain really core naturopathic
Principles.
philosophy.
Yeah.
Principles. Because if you're going to see a naturopath, it would help kind of prime you for like, oh, this is because they're, like our mentor used to say, like flat earthers and round earthers. It's like sometimes there's just like this different philosophy, right? Between how the naturopathic doctors are looking at, a medication or a therapy versus how we see it, right? So those are 4. And then you're going to do one on, you had said, on the healing crisis Herxheimer. So stay tuned for that one.
It's going to be part of it. It's going to be like Detox in the Body Bucket, miasms, and the Herx. So.
Ooh, that's so exciting. I'm so happy we got to finish this conversation on mold. We had some really good topics we talked about today with antimicrobials, when to do them, healing crisis versus Herx versus detox. Is there anything else you want to share today before we close?
I think we talked their ear off.
I know. You've heard quite a bit about mold. Do you want to just share quickly about some of the ways that people can work with you, offering free consults to see if you're a good fit? Because you want to sometimes just see if the personality of the doctor and if you guys jive, if you like each other's energy. So maybe about the free consults, and then the either pay-as-you-go visits or what are the packages that we offer patients?
Yeah, so I do offer a 10-minute free, we call it like meet and greet or courtesy call, to get to know people a bit and to really answer the questions of like, how do I practice? Like, because it's just so different than what people are used to, right? So it's not a call where you're like giving me all your symptoms and I'm giving you advice. Like, that's not the call. The call is, how do you work? What is it that's different? What do we do? Those kind of things. And how could we help you that's different than what you've been doing? Because obviously you've been doing something that hasn't been working. So you're coming to us.
Yeah.
Right?
Exactly.
Only 10% of you are just like, oh, I love naturopathic medicine from birth, So, and then we have pay-as-you-go pricing, right? Obviously. And then there's different like gold, VIP, and platinum silver, gold, platinum packages, but then we formulated a mold package because typically if someone really is dealing with mold illness, it's they're pretty sick, and it's usually, I think 6 months is a nice round place to kind of place it at, because as you heard earlier in this podcast, we're starting with foundation, working all the way to biofilms and antimicrobials, and it takes a while for the body to be able to do that.
Absolutely. So you can make a free consult on our website. It's www.naturallysue.com. We have a contact form. You can ask us a question or request a free consult with Dr. Sparks there. Thank you so much for being here. Thank you for all of your expertise. It has been amazing to talk about this with you. And if you want to follow Dr. Sparks on Instagram, don't forget to go to her Instagram, Dr. Sparks ND. Thanks again. Have a lovely
Yes,
weekend.
thank you.
Bye-bye.
Bye.
For any Microbalance Health products, please visit microbalancehealthproducts.com and use code MDN at checkout for 10% off of your order.
Thanks so much for listening to Modern Day Naturopath Podcast with Dr. Sue.